Yeah, hi Giselle.
Hi.
So there's a special guest. She is an ultrasound technologist and she makes YouTube videos on Las Vegas, Disney, and ultrasound. Her videos are really informative. Please check out her channel. I will put the link in the description. First of all, Giselle, a very congratulations for reaching like the 1,000 subs, and because it's like a milestone. So how are you
Oh my gosh,
feeling?
yes.
So
Thank you
how are
so
you feeling?
much. Oh my gosh, thank you. That was an awesome intro. Um, I don't even believe this is happening right now. Like, I don't even I gave myself a whole year to reach 1,000. So for it to happen in a couple of months, I don't know. It's surreal.
Do you feel some kind of pressure, like not like I have like these viewers, they are waiting for my video, so do you feel that pressure?
Oh yeah, I definitely do. I feel like it's been so much anxiety because I have I'm an overthinker. So when I'm thinking about all these people watching and then everyone asking for these videos, I'm like, oh gosh, like so little time. But really, like they say YouTube's like the for the long haul, if you're in it for the long
Yeah.
haul, like
Mhm.
consistency. So I'm trying, like I'm pushing out all these videos, and I think that's how I got so many subscribers so fast. But I mean, it's a lot. I mean, I wouldn't have been able to do this if I didn't
Mhm.
have all this free time. So,
Mhm.
so lots of pressure because like I'm getting comments and I'm like, oh my gosh, how am I going to do this video?
So like in fact, like the one thing as an YouTuber we dread the most is the dislike button. I also saw your
Yes.
post somewhere, right?
Holy crap. Yes. So the weird thing about the dislike button, like, at first you pop out all these videos and everyone's liking them, and then all of a sudden you just start getting all these dislikes. And then I was like, what? And every single video I would post, like right away, I'd get like 4 or 5 dislikes. And I'm like, this isn't real. Is this real?
I guess it's kind of a success story also when you start getting dislikes as well. because I,
Yeah, yeah.
because I've seen no video without dislikes.
Yeah, so everyone in the Facebook groups that I've been like seeing, post, they're like, I got my first dislike, yay. Like they're super happy about their dislikes. And I'm like, oh, this is so crazy, but yeah, they say you make it when you get your first dislike.
Mhm.
So we made it. We made it.
I think like even they are all posting it, but somewhere deep beneath their mind, they are still feeling that dislike. I think
Yeah,
we are
still,
just, it's a coping mechanism to like
it
see it in a
really
success
is.
way, but it still hurts.
Well, you know what? Like I say, make everything positive, right? You
Yeah,
turn
yeah,
something
true, true.
negative, positive. So, deep down inside, it really hurts you guys. That dislike button, it hurts. But we're creators and we're just gonna let it be.
Like a question is like popping up to my into my mind. Uh,
Hmm.
like as an ultrasound technologist, like did you I know had some kind of a weird case or some kind of like an exceptional case you came across?
Yeah, so you know what? We get that question all the time.
Mhm.
Weird cases. And the thing is, it's like, what do you consider weird in the body? Because when you're doing an ultrasound, the point of doing an
Mhm.
ultrasound is to see what's wrong with this person. So
Mhm.
if something's wrong, that means something's wrong. If there's abnormal, like if there's something
Mhm.
that shouldn't be there,
Yeah.
that's already weird in itself, right? But unfortunately, that means something's wrong with the patient.
Mhm.
So, but one of the weirdest things, I guess, a lot of people don't know this, but you can have all your organs on one side of, like, all your organs are on
Mhm.
the right side, most of them, right?
Okay.
And you can be born with it on the opposite side.
Mhm.
So one time I saw a baby like that, which is, extremely rare. But so that was
Yeah.
really weird. And then, so it's like things like that would be weird to us, right? But
Mhm.
it's not like X-ray where like, in X-ray you could see some weird object inside someone's body. Like we
Yeah.
can't see that kind of stuff with ultrasound. But
Uh-huh.
I mean like weird things, anything abnormal. I mean I've seen like really really bad like uh there's this like if your toes are like necrotic, like I don't know,
Uh-huh.
it's just things that you see that are like weird and gross that
Yeah.
you would never think that you would see. but
Yeah,
like we see it,
yeah.
people don't know that we have to deal with that kind of stuff. Or like, not ultrasound related, like some patients are like literally going to the bathroom while you're trying
Mm,
to like do your exams. So lots of weird things like that. But
mm.
a lot of times it's abnormal pathology. Like one girl, like when I scanned her, she said she had two, uteruses, and I'm like, oh, interesting, like interesting
Yeah,
cases
my
like
God.
that.
Yeah.
Two, she was like, I had two cervixes, and they performed surgery on me.
Mm.
So like weird things like that.
Uh, so, like I read one of your posts, like I was, so in that post you said like you are not allowed to tell your patient. So I was like
Yeah.
a bit confused, like why, like
Mhm.
something is wrong with you. You should
Yeah.
have, you have to tell them, right? So why are not
Right.
you allowed? Yeah.
So here's the thing with ultrasound. We Most people don't think we know what we're looking at because we're not
Mm.
allowed to tell you. And some people are like, "Oh, well, my ultrasound tech told me this, or my ultrasound told me that." Well, we're not supposed to tell you because we're not doctors. And in other countries, so I don't know in your country, but most of the time, other countries, the doctors perform the ultrasound. So technically, we're almost
Uh,
doctors, right?
yeah,
We're
yeah.
in the US, like we're almost doctors, but we're not doctors.
Ah,
We do the work for the
yeah,
doctors,
yeah, yeah,
right?
yeah.
Because like if we don't see it, the
Mm.
doctor doesn't see it.
Mm-hmm.
And when when we diagnose, that's the doctor's job. So the doctor has to tell you what's going on. So a lot of times these patients are like, "Do you see it? Like, do you see what's going on?" And you really have to have like a poker face, and you have to
Ah,
like not
yeah,
let your face show that there's something
yeah,
there,
yeah. I kind of get it, like because like people are very curious about like what is the test results, but it has to come from
Yes.
the proper channel, right? So
Yes, has to come from them
yeah,
because if I say something and then the doctor doesn't say it in their report, then I get in trouble, right?
yeah,
So
exactly.
if I scanned your abdomen and I think I see something and the doctor looks at it, doesn't agree, doesn't mention it, we're not the doctor, right? So if I said that to you and you were like, "Oh, she said this," I could get in trouble. There could be like lawyers and blah blah blah. So we just
Yeah.
try to avoid that.
So, like, is there any like in the COVID-19 situation,
Mhm.
like the sonographers
Mhm.
had like any impact on them?
Yes, yes. Actually, we're like a big, big part. They actually came up with some articles and
Mm-hmm.
research that the ultrasounds will help with looking at the lungs.
Mm-hmm.
Because a lot of times if you get COVID, your symptoms are mainly like things that are related to pneumonia, shortness of
Mm-hmm.
breath,
Yep, yep.
and your the ultrasound can show the lungs, and if they're collapsed, they could show the movement of them. So they don't do that. We don't do that in our hospital, but I
Mm-hmm.
know that they have doctors, because they're the doctors.
Mm-hmm.
They've been using these machines to actually look at the lungs and figure out what's going on. So in my field of work, we just check around the lungs to see if there's fluid, like fluid buildup, which is called a pleural effusion.
Mm-hmm.
And so we can see the lung and then the fluid around it compressing on that lung.
Mm-hmm.
So we can tell that from ultrasound. And a lot of times they will order ultrasounds for these COVID patients on their legs or their arms because they're more susceptible to blood clots. And we also detect blood clots. We're like the one modality that will tell you if you have a blood clot or not. So, I mean, we are with a patient for at least 15, could be up to 30 minutes. So we're actually exposing ourselves to COVID pretty high.
Mm.
And so it can be really stressful.
Yeah, yeah,
Um,
yeah.
but they do give us, personal protective equipment
Mm-hmm.
so we can wear all this stuff to protect ourselves. And we also have protocols how to clean and disinfect. And knock on wood, our department has been doing really well. No one has gotten COVID, like knock on wood. So we've been doing really well with our
Yeah.
policies and cleaning.
Mm-hmm.
Yeah.
Awesome.
But ultrasound is definitely used with these patients for sure. People don't know that. People don't know we're actually
Mm-hmm.
scanning them. And when they find out that I am, I'm like, yep, Like it's scary where we're literally frontliners, us and the nurses, the X-ray techs.
Yep, yep.
X-ray scan them, or X-rays like take their X-rays every single day. They're
Mhm.
in there, in those patients' rooms every single day. So they monitor the fluid around their lungs, their chest, their heart. So it's pretty crazy. It's made it so much busier, but also so much slower in a sense because everyone was afraid to go to the hospital. We were also trying to keep people home, try to stay away from the hospitals.
Mhm.
But you know, we're all trying to do our part to help these people in this situation. It's crazy.
Awesome, awesome. So, how like the sonography technology is like different from the X-ray technology. So, like,
Yeah,
what these two like have the difference? Like, what is they show?
that's a good question. so, so X-ray, it's shooting radiation through the
Mm-hmm.
body.
Mm-hmm.
So it's not a lot of radiation, but it is shooting radiation, using radiation to see mostly bones.
Mm-hmm.
So they'll see it if you like break your bone. But they can see like edema, they can see your heart if it's enlarged, they can see fluid, they can see a lot of things in X-ray. Like they also look
Mm-hmm.
at intestines and stuff like that. But ultrasound's a little bit different where we don't use radiation. It's all sound waves. And
Ah.
the sound waves are, it's the machine that's producing the sound waves
Mm-hmm.
going into the body. We use gel, that
Mm-hmm.
infamous gel that people are
Yes,
like,
yes, yes.
it's cold. Yeah, we have to use that gel because that's going to be the interface that
Mhm.
helps those sound waves go into the body.
Ah.
It bounces off the organs, comes back to the machine, takes a picture and
Okay.
all that.
So, like, it's kind of echolocation, kind of, is it?
Yes,
Yeah, is it?
exactly.
I should have
I
like,
have a Yeah, it's exactly echolocation. Where's my
yeah.
cap? This is my graduation cap. I don't know if you can
Ah,
see it.
yeah,
Oh
yeah, yeah.
no.
Yeah, I
It
kind
says
of see
it's
it.
time
Yeah,
to use
yeah,
my
yeah. It's perfect.
echolocation. Yeah,
Yeah,
and it's a
yeah,
whale.
yeah.
He's
Right, right,
from
right, right.
Disney.
Is it?
He's from Disney and
Is it dolphin?
he's
I guess
shooting.
dolphin uses echolocation.
Oh yeah, dolphins do too. But he's a whale.
It looks like a dolphin.
Wait, is he a dolphin? I'm pretty sure he's a whale. Now I need to know. No, I think he's. Well, yeah, definitely dolphins use echolocation.
Yeah.
What's his name? Disney beluga whale. He's a beluga whale. Yeah, Bailey. His name is
Okay.
Bailey,
Awesome.
and he's from Finding Dory. I don't know if you've seen that movie.
Yeah,
Um,
I have,
Finding
I
Dory.
have. Yeah, yeah. I've
Yeah,
seen almost all Disney movies.
yeah.
I like
So
them.
he looks like a dolphin, but yeah, dolphins and whales they use echolocation. So
Yeah,
exactly
yeah,
what
true, true.
ultrasound is doing,
Mhm.
and it bounces off, and you can see mostly soft tissue, fluid,
Mhm.
stones, calcified stuff. But we don't. You can see muscle and whatnot, but we don't assess bones. That's mostly X-ray.
Okay.
They're two totally different things that
Actually,
people don't
you
know.
know, as I'm like talking to you, I should have inferred it. Like sono means sound, so
Oh yeah,
sonography.
yeah, yeah, yeah.
You
Sono
know, it's
sound. Yep.
perfect, perfect
Mm-hmm.
echolocation.
Yes.
Okay, new thing I learned today actually.
I know, yay. Yeah, a lot of times people think that the machine just takes the picture, but we're
Mhm.
actually maneuvering the machine. We're the ones that are we're changing the frequency, we're actually changing the pulse waves, like we're
Mhm.
maneuvering the machine to take the picture. It doesn't just take the picture. Like we have to
Mhm.
know how to use it. Like using
Ah,
a computer, the computer doesn't just
very
do
right,
itself.
right.
Like we have to use
Mhm.
the computer.
Have you ever watched the series House? Have you watched it? Okay, so
Is that
basically,
a show?
yeah, it's a TV series.
Yeah, okay. Yeah, no, no,
So,
no.
basically, I'm like, what I'm trying to ask you about is, like, do you sit like on the table and to diagnose with the doctors? Do you like sit there, like,
Oh,
kind of
okay.
like what the show is all about? They're
Yeah.
trying to, portray like it's kind of a detective series, but they are trying
Mm-hmm.
to find what is wrong with the patient. So
Okay.
so it's kind of that
And
detective series, and but yeah,
yeah.
but the culprit is your disease, And so like,
Oh, okay.
they're trying to diagnose the person, right? So do you
Hmm.
sit with a doctor and try to understand, like, yeah, so
I
like,
mean, you can. You know how in the TV shows the doctors are in the actual exam, or like if they're doing an X-ray, for example, or a CAT
Mhm.
scan, usually the doctors are sitting there like looking at the screen and they're like, oh, it's this. Like it's not really like and or even in ultrasounds, like when the person is scanning, it's usually the doctor in the TV shows. It's not
Mhm.
an ultrasound tech. It's the
Mhm.
doctor that's like, oh, it's a boy, it's a girl.
Mhm.
So we don't really sit and talk to the doctor. I mean, there are places that do that. It is a very like, it depends on where you work. It's a very varied position. But in most hospitals, you just take the pictures. Like you don't even really see the doctors. The doctors who are
Ah.
reading our pictures are radiologists.
Mhm.
And usually the radiologists are sitting in their what's called a reading room. And it's like a
Mhm.
dark room, and
Mhm.
they're sitting in this dark room just staring at computers all day and looking at images all day.
Mhm.
So they also do procedures and they also do other things, but
Mhm.
their main job is to read and diagnose these patients with
Okay.
the exams, so the X-rays, nuclear medicine, CAT scan, MRI, ultrasound, and they're literally just sitting there reading these things all day. So we barely see the doctors unless we have to be like, if there's a weird case, we'll call them on the phone.
Mhm.
And some places you can just walk into that room and be like, hey, doctor, uh, this and this and this. Like, I saw this. I'm kind of confused. Like, you can talk with
Mhm.
them. But
Ah,
it's never in the moment unless it's something
okay.
like if it's a trauma patient, even then they're not really with you scanning
Mhm.
the patient. You just scan the patient, write your report, and then they read it.
Mhm.
So I was, gaining more weight
Mhm.
after high school. And it was mainly because my grandma used to feed us bacon all the time. But, I had to get into some kind of fitness and active
Mhm.
thing
Mhm.
after everything catching up to you from your
Mhm.
childhood. So then we started going to the gym with a couple of friends. It was the university gym.
Mhm. Mhm.
And our university gym was really cool. It was like brand new equipment at the time, 4 stories, has a track on
Wow.
top, a lot of basketball courts,
Mhm.
gym equipment. So that's where I learned how to actually just like go to the gym. But I wasn't actually into fitness
Mhm.
until 2017 and going to the gym actively to just stay fit and stay active and healthy because I want to live longer and I have a history of diabetes in my family, hypertension, so anything we can do to prevent that kind of stuff. That's why I like fitness, promoting it. And also as an ultrasound tech, you have to be pretty strong almost because sometimes you have to push really hard on people. They don't know, but ultrasound is actually, you know, us pushing up against you. It's not just like
It's stressful
gently.
job. It's
Um,
stressful.
it can, yeah, it's got its own stress. But
Mhm.
if you think about like nurses or doctors,
Mhm.
right?
Mhm.
Respiratory therapists, for example, physical therapists,
Mhm.
we all have a stressful portion of our job, but it is less stressful than most because I just do my thing. When I go into work, like I do my thing. I I get my patient, I scan them, write the report, they go. Like nurses spend days with their patients, or
Yeah.
those patients are almost like really needy at some point. But for us, like we only see them for 15-20 minutes, and if
True.
something
True.
goes on, I usually just tell the nurse, I'm like, hey, your patient, but it's the truth though, because we're not trained to do nursing stuff.
True.
Like,
True.
and if a patient really wants something, a lot of times we can't even give it to them because they'll
Mhm.
ask for like water, they'll
Mhm.
ask for food, and it's like, I'm sorry, mister, I can't get you food. Like, I have to let your nurse know. So
Mhm.
at that point, our job is stressful when you can't see something, or you're trying so hard to find a left kidney and you can't see that person's left kidney, or you have so many patients on your list, and
Mhm.
you can only go so fast, you can only scan so fast, and doctors
Mhm.
expect you to scan faster, and I'm like, you try scanning, like sometimes it's a little difficult to go fast,
Yeah.
and you can only go so fast, the patients are in pain.
Mm, true, true, true. Actually,
Hmm.
like it's in the every case of like a employer-employee relationship. they,
Yes. Yep.
they will always expect you to work faster than you are
Yeah.
already.
That's what they expect. I'm like, well, then, like, you go talk to your patients. Like, this patient's been asking for you. Like, every time I go to exam, they ask for the doctor, and I'm like, I'm sorry, I don't know when the doctor is rounding. They do their own thing, right? So
Mm,
I could say the same thing, but at the end of the day, we're all trying to do our best and you
true,
know
true.
do the quality work. And sometimes it's really hard to see stuff with ultrasound. Like, it's not a magic
Mhm.
machine.
True, true.
Some doctors want you to see, say, like a little baby
Mm,
cyst, right? And on
mm,
CAT scan you can see these cysts, but on
mm,
ultrasound, if it's like really small and you're like sweeping through the
mm,
kidney or the liver, sometimes it's really hard to see it. So
mm,
some people will stress out about that.
mm,
Others will just be like, ultrasound's not magic, we can't see everything.
mm.
So we do our best, we try. But I try to not make it stressful, because like, the medical field is already stressful as it is.
True,
So when
true.
people are like, oh, you're saying it's not stressful, well, it's only stressful if you make it stressful.
Mm,
And I stress out a lot of times, but it's not enough for me to say like, I hate this job, it's so stressful, I don't want to go back. Like, I love my job.
mm,
So it's probably less stressful because I do love my job.
mm.
It's funny
So,
because I actually just had a Facebook comment recently, and she was like,
mm,
I was answering an ultrasound student,
mm,
and then another like seasoned ultrasound tech
mm,
was like, are you, she's like, how long have you been in this field?
mm,
It sounds like you don't know, it sounds like you don't know, because this is a stressful job.
mm.
And then I responded to her saying like, oh, like, I've been in it for a couple of years, but I didn't say it's not a stressful job. I said it's a less stressful job, a different kind of stress. Like, it didn't come out as it's not stressful. It is stressful, but
Well,
not stressful.
if you
I don't
if
know how to
you
explain it.
if you start comparing, then okay, like the surgeons who like that's stressful, like you
Yeah,
are
that's
cutting
stressful.
you're cutting open the body,
Yeah, someone might die. You know what
yeah,
I'm saying? Like, at least
exactly.
for us, we barely see that kind of stuff.
Yeah, or
Barely.
maybe if you're going to like in the army, you are right, you are in war, yeah, that's really
That's
stressful.
stressful. Oh yeah, that's stressful. Like, think about it. But
but
and
but
the only
but
go ahead.
you can't compare, like
Yeah, you
even
can't
when
compare.
I'm going in my corporate job, I'm trying to like create something, like and there's
Mm-hmm.
a deadline, you always like have
You
that
stress.
pressure, there's
Mm-hmm.
there's some stress. It's not like
Yeah.
like there
But would you
you
call it a
yeah.
stressful job? Like, if you liked, what you're doing, would you call it stressful even though there is some stress in there?
Yeah,
Would you
like
say the career is stressful?
yeah, you like like you have worded it correctly, less stressful. It is stressful,
Yes.
but less stressful.
But less stressful. I wasn't trying to say it's not stressful, but in general, like, I don't stress out because I see my patient for 15 minutes. Maybe that exam is so super stressful to do, like, oh my gosh, that was a hard exam, but you don't like dwell over the fact that it was a hard 15-minute exam. You just move on to the next patient. Because if you sit there and stress
Mhm.
about that patient, if you go to the next patient and you're stressing about that patient, then you can't do this patient correctly. So your stress level is only high if you make it high.
True, yeah, yeah, yeah.
Yeah, yeah.
So, uh, so as in like an ultrasound technologist,
Hmm.
like the doctors and the nurses have that, night shift. Do
Hmm.
you also have night shifts?
Yeah, so we do have night shifts.
Mm-hmm.
In most places, they have what is called on-call shift.
Mm-hmm.
So from one time to another time. So let's say like
Mm-hmm.
11:30 p.m. to 7 a.m., which is normally the on-call shift. Somebody will be the on-call, and if they have an exam, they call you up in the middle of the night and tell you to come here.
Mm-hmm. Oh.
So a lot of ultrasound techs do not like the call life, but
Mm-hmm.
you start off having to do it because
Mm-hmm.
that's the type of job that most people out of school will get, like a call
Mm-hmm.
shift. And it's it's interesting because, for example, when I used to work at one hospital, I would get called in at least 4 to 6 times a night. I would sleep in my car, and then when they call me, I'd wake up and then I'd go inside and scan the patient,
Oh
and then
my
I'm
God.
awake, and then if they don't have anything else, I'll go back to my car and like sleep. Some places have call rooms, or you can sleep in the ultrasound room. I wasn't comfortable with doing that. I would
Mhm.
rather sleep in my car than sleep there. But it's a weird aspect, right?
Mhm.
When I worked in a city called Pahrump, which is about 45 minutes away from my house, they would provide the call shift with a house. So the hospital is like right here, and then there's a house. So if they called
Ah.
me in, I would just drive and then go back to the house. And
Oh,
sometimes
okay.
it's difficult because you never know if they're going to call you back
Mhm.
or not. Some
Mhm.
people stay awake the whole time. There
Mhm.
was one time when I worked at a busy hospital, I would just like go eat in the middle of the night. Like I went to
Mhm.
In and Out and I just grabbed a burger because I was like, who knows if they're gonna call you back, you know? And it
Uh-huh.
messes with your sleep schedule. But
Uh-huh.
that is a majority of what ultrasound techs have to deal with, the call life. And I'm gonna eventually do a video of that eventually. But there are some places like my hospital that's
Mhm.
so busy that they do need a tech at night. They will
Mhm.
have techs at night, the graveyard shifts, and it's
Mhm.
actually pretty steady. There's always people coming in the hospital 24/7. And if you're a hospital that has so much, like so many people coming inside, they're gonna keep you on the schedule, and you'll just be there all night long. And for our hospital, I have some graveyard shifts, so we try to do all the stats. So those are all the patients coming in through the emergency room. That means they need to be done right away. But then there's also the routines. So patients that are inpatients that are already in the hospital that doctors order, they're not stats per se, but they
Mhm.
need to get done. So if you can do it, then you do it in the middle of the night.
Ah.
I've scanned some patients at like 2 or 3 a.m. and a lot of times they don't mind. I mean, they're in the hospital, they're not going anywhere, you know.
Mhm.
So
Okay. So, uh, so one thing I was like wondering, uh,
mhm.
like you, you have uh, like the one thing you have checked out from your bucket list, like going to
Mhm.
going to Florida. Like what's
Yeah.
else? What's else in there? What else?
You really want to hear my bucket list? Well, they're all have to probably do with
Mm.
Disney. I mean, I would like to go on a Disney cruise. I love cruises,
Uh-huh.
and it's funny because, you know, like I've been on a cruise every single year since like
Mm.
2014 or 2013, and this year we couldn't get on a cruise because of COVID. And like cruises, they call it the petri
Mm.
dishes, right?
Mm.
Because all of those cases that came from cruises.
Mm.
But that's one that I want to do, is go on a Disney cruise. I definitely just want to travel the world. uh, you know, that's all on my bucket list. I don't one day hopefully get married and have kids, you know, but I don't really have crazy bucket lists. It's always like, let's go to Disney Tokyo, or
Uh-huh.
I don't know. It just makes me think now that I'm pretty content with life, that I don't have a bucket list because I already made Disney World, and I already crossed it off. So
So, Giselle, just this is like had been like a long and amazing conversation. So,
mhm.
so so just
Yes, it has.
so I want, like, if you have anything to, like, to tell the audience, anything you
Oh,
wish,
anything?
maybe,
Well,
yeah.
go check out my channel.
Surely
And no,
should, surely should.
shameless plug. No, but really, I really enjoy this. This is a lot of fun, and this was obviously, you know, we had another collab before, which was my
Yeah.
first collab ever. I don't know, have you done collabs before that one, or
Nope,
was that your
nope.
first?
That was
Yeah,
my first.
that
Yeah.
was your first. So, you know, that was my first as well. So we both had our first collabs together. Look at
Now it's
us
a
now.
podcast.
Yeah.
There's a
And
podcast together.
yeah, now you've had all these podcasts. I seen your podcast with the other people that you've done. So they're actually really good.
Mhm.
I like listening to them. Like everyone has a lot to say. There's so many things to talk
Yeah,
about,
exactly.
so much in the world. And I always like, people are like, oh, you should do a podcast. I'm like, what am I going to talk about? But like, think about all the things we talked about.
Yeah,
So,
this is like two people having a conversation. That's all. And then,
mhm,
but what I felt is that when you are on podcast and the conversion happens, there's
mhm.
definitely something new, from both sides, which
Yeah.
comes into being. That's
Yeah. And I
amazing.
love it. It was so fun. So thank you so much for having me. Yeah,
Yeah,
this was really fun, and hopefully there's more in the future.
yeah, definitely. We are also planning a collab. It might take us some time, but it's
Oh
going,
yeah, yeah.
let's try for that as well. And you
Oh yeah.
definitely, I'm gonna call you again for my podcast as well. In
Oh
other
yeah.
episodes.
Yes.
So
And then if you come to Vegas, you know, hit me
definitely.
up.
So
I
uh,
literally won't even mind. We can go do whatever.
so I have some years left in my visa as well, so I can visit maybe.
Woo, yeah.
So yeah, so the podcast would be like distributed in a lot of places. It would be in Apple, it would be in Spotify, in
Really?
Google. Yeah, it would be a lot of places. So they all
Wow.
so all the links would be in the description, and there
Uh-huh.
would be a video format
Wow.
as well.
That's
So
so cool.
yeah, amazing. So uh, watch
Thank
us,
you.
watch us, and
Dang. Yes.
please subscribe.
Yes, subscribe.
Jessel, I will put the link on
Yes.
the description, and
Thank you.
catch you in the next podcast.
Yes. We'll see you on the next one. Subscribe to Ninja Advisor. Do it
Hey.
now.
Wonder, wonder, Alice. Wonder, wonder.